lots of kids are naughty. That's the blame from the adults. So naughty kids, they do lots of mischievous things, and then they don't stay in one place. That's very natural. But apart from that, when they do it too much, when they can't be in one place at a time, even when they want to do a thing, with the thing which they like to do, even they can't stand or sit one place, is a matter. Usually kids are naughty, yes. If a kid is not moving here and there is a sickness. So the natural normal kids are always moving here and there, and they love to do different naughty things. But the hyperactivity is something different to that, which they can't stay in one place. And even when they want to do a liking thing, which they cannot be in the place. So their short attention, moving attention affects that. So they diagnose, the medical component says it's hyperactivity. And also they may be having attention deficit difficulty. That's, they change their attention. They can't do one work. Even when they are adults, they can't do one thing. They want to change their things one after one. Sometimes maybe jobs, maybe the work they are doing, and their attitudes. So those things can lead to such matters. So attention deficit brings the child's learning difficulty also. Learning ability affects with the ADHD, attention deficit, and the hyperactivity. They do run here and there and jump and climb and all things continuously without a rest, called hyperactive. And there are different stages of that also. ADHD is one another thing, sometimes cannot be seen from the child because the child is not here and there and jumping, but their thought is different, changing the thought, to do things, to change things. So that's attention deficit in simple way. For you to understand how are the kids and why you all annoyed about the matter. Maybe attention deficit, maybe ADHD, maybe hyperactivity. And also attention difficulties are there some more which the child can't concentrate. This cognitive power differences. The concentration issues also gets different outcome in children. They can't stay in one place. To make them aware of that and to make them in a proper order, in line, the adults around the child has to concern. Without shouting, without hiding, you can use play. You can use different games with instructions and keep on them continuously, as also the very important as speech and language therapist to assess, and sometimes this behavior therapists come, and sometimes this attention works with the special education teachers as well as the team which they work on. So if you have a naughty child running here and there and not doing one work in one place, so start doing some games with them with rules. And some will say one art or a collage or whatever, cheer them till they finish it. And you have to quickly do it, otherwise they can't maintain. I advise my parents, my kids' parents sometimes, when you start work, you show the time if the child is aware about that, and you tell now it's 5 minutes, okay, now this work we are going to do 10 minutes, and if they don't get up even, you have to start them go. There are different techniques and tips for parents. So if your child or any child is with attention deficit, we have to intervene from the home base. Not that you are bringing to the child to the clinic and doing different and taking them home. So you are the one who is living with the child. You have to care about that. You have to guide and line this child's behavior in order to the attention expansion activities with the happiness. So there are a lot more to tell you about this. So another clip, I'll be explaining more different things about this attention work, and then identification is very important. Thank you.